Welcome to Kenton's videos. Enjoy the video.
In this video, I will explain how to study microbiology nursing. First, focus on understanding the basic principles of microorganisms, including their structure, function, and how they cause disease. Next, learn to link these scientific concepts to real-world nursing applications, such as infection control and patient assessment. Finally, develop a systematic approach to reviewing material regularly to ensure long-term retention and mastery of the subject. To truly excel, prioritize understanding the most common pathogens you'll encounter in nursing, focusing on their modes of transmission and how they present in patients. Don't just passively read, actively test yourself on microbial classifications and treatment protocols. Consider using a spaced repetition system for flashcards to reinforce your knowledge of key terms, drug actions, and diagnostic procedures over time. Enhance your learning by forming study groups to discuss complex topics and gain different perspectives. Actively practice applying microbiology principles to various clinical case studies, which helps solidify your understanding of real-world scenarios. Drawing concept maps is also incredibly effective for visualizing the intricate relationships between different microbes, their associated diseases, and potential nursing interventions. Always strive to connect microbiology with other nursing subjects, especially pharmacology, to understand how antibiotics work against specific pathogens. Consistent, regular review of previously learned material is crucial for long-term retention and building a strong knowledge base. Remember, effective studying is a marathon, not a sprint. Also, for some great deals, including a link to those amazing darn tough socks with a lifetime warranty, check out the description below.
Thanks for watching. Consider subscribing if we helped you.